This is the Ricochet Report. The Ricochet Report.
Welcome to the Ricochet Report, the show that talks everything and anything firearms. I'm your host, Brad. On today's episode, we're talking med gear. If you guys know my background, prior to any LE work, it was med. Worked as an EMTB, Brooklyn North, Brooklyn Central, Brooklyn South, and I did a lot of my medic rotations all over the place. Staten Island, Brooklyn, Manhattan, etc. I also have gone through a multitude of courses for both personal and instructor level certifications. I've been through the CONTOM School, Counter Narcotics and Terrorism Operational Medical Support. That's where I got my EMT Tactical certification. I've been through TCCC, TECC, Stop the Bleed instructor, CPR First Aid AED instructor, etc. So, always in field medicine though, right? Here's what we're talking about today is specifically med for the individual. Because of the nature of the show, we'll start with firearms related injuries or traumatic injuries, whether it be penetrating or blunt force trauma. Because that's, I guess, like the sexy stuff. But then you got to remember there's a whole other side of medicine that you can't see, right? There's the medical side, not the traumatic side. The things are what's going on inside someone's body based on their illness, based on prior conditions that they have, pre-existing conditions, and more. So building an IFAC, right? Individual first aid kit and a family first aid kit, right? These are the realities of what you should have. Okay, an IFAC is great to keep in your range bag if you work in an armed profession, whether it be military, law enforcement, armed guard, etc. Yeah, an IFAC of some sort is a great tool to have. But realistically, what we should be doing is building bigger kits because we have the ability to store them in places that can hold bigger bags, right? So vehicles, right? I'm with my vehicle a lot. I'm sure a lot of you are too. In your home, right? We see all these crazy things are kind of happening around us now. These fucking balloons from China floating over. Crazy things cause people to panic. When we look at 2020 and all the panic that ensued, toilet paper and things like that became scarce. So it's a really good idea to stock up on medical gear, especially certain medicines that our loved ones or ourselves may actually rely on, depend on, and need. So we're going to go over all of that in today's episode. So let's start off with the sexy stuff. We'll start off with IFACs, right? Generally, what we're worried about is the ABCs, right? Or in the care under fire world, we'll use the acronym MARCH instead of ABC like we do in the EMS world. So what ABC stands for is airway, breathing, circulation, and what MARCH stands for is massive hemorrhage, airway, respirations, circulation, and hemorrhagic shock, right? So what are those entailing as far as gear goes? Well, airway is anything that's going to help us maintain a airway, right? For someone who their airway may become compromised and we need to use a tool of some sort to, we can't guarantee their airway with the basic life support tools. And with some more advanced tools we can, but more advanced tools require more advanced training, and it's something that we may not be able to do unless you have certain certifications. And it's also something that we might injure someone practicing trying to do. So stick to the basic stuff, and if you really want to go down that road, it's doable, but we're talking about at minimum paramedic for some of those advanced skills. So just keep that in mind. Never bad idea to learn new skills. Just do it in a safe environment, and make sure you're acting appropriately and accordingly, and you're not putting yourself or any others in danger. And certified to do so always helps as well. So airway. how can we maintain an airway for an individual on a basic level? Well, if you've taken a CPR class, you already know head tilt chin lift is one way to open up an airway. Another way to open up an airway is the modified jaw thrust, right? In case they have some sort of injury to the C-spine. It's a way of not compromising the C-spine, the cervical spine. That's what C stands for. So what else? Tools. What kind of tools are there? We have OPAs and NPAs, oropharyngeal airways and nasopharyngeal airways. More common, what you're going to see is nasopharyngeal airways for a multitude of reasons. Those are the green-looking tubes with the little cup at the end, and it comes with a little pack of lube, so you can help get it down that nostril, if you will. There's ways to size these. The thing that's really interesting is a lot of times these are they pick a general size that fits the average adult male, and that's what you get in the package. But these are actually, when used on an ambulance, these are sized accordingly to the individual. We'll measure. There's a way of measuring it, which is not hard to do. It's done on the fly, and it's unique to that individual size-wise. So if you're building your own kit, maybe you should measure your own and go about it that way, right? That would probably be a smarter idea measurement-wise. And you measure from the septum to the earlobe. That's how you'd measure an NPA. An OPA is not as common for a multitude of reasons. But that one, if you want to do that, it's the earlobe to the corner of the mouth. So those are your two ways of figuring that out. And what that's going to do is it's going to help maintain an airway. So if we have to deliver rescue breaths, whether it be by mouth or by bag valve mask, we have the ability to do so. Continuing on, breathing. So what is breathing? In ABC, breathing, or in March, we skipped over M. We'll get to that in a second. Respirations, right? So we have a couple of things there, and we just talked about it a little bit with the bag valve mask. Now, a bag valve mask, even the quote unquote tactical ones that kind of pack small, play big, they're still a larger object. They don't necessarily fit in an IFAC that you would keep in a pocket on your belt, etc. But they certainly do fit in a backpack, in a vehicle kit, in a home kit. So there is a place for a bag valve mask, and now what that's going to allow you to do is deliver more consistent respirations to the patient, more successful respirations to the patient, and you're not going to get as fatigued, right? And that has to do with also the successful and consistent, right? The ability to squeeze a bag while successfully applying a proper seal because you're sitting upright, you can see what's going on versus leaning over and delivering your own breaths. You're going to get fatigued sooner. You may not be consistent with the breaths you deliver, etc. Also, a bag valve mask has the ability to connect to oxygen, which is a really big deal because now we can get as close to 100% as possible of oxygen delivery versus us breathing out into the individual. So that's a big part of it too. Now, not just talking about tools though. We have to be able to recognize that this person is suffering some sort of injury or illness that is requiring us to do these things to them. Okay? So, learn these things. You can look it up. You can Google it, right? Just make sure you're going to a reliable source of information where you're getting the information about medical stuff. We can probably put some links up for you on reliable sources. American Journal of Medicine is a really good one. There's plenty of other places to get some good stuff. The Red Cross happens to be a good place to look for certain emergencies and answers that you may want. Avoid places like ask.com where anyone's giving their own answer to it. Make sure that the person who's talking about it has some knowledge and the credentials to back that up. So continuing on, circulation, right? What is circulation? Well, circulation is what we're talking about is the blood moving throughout the body, which is carrying oxygen in it, right? It's oxygenated blood that's traveling throughout the body, as well as deoxygenated blood. But we care a lot about the oxygenated blood. That's the good stuff. That's the stuff we want, getting to those organs all the way into our fingertips and toes, right? It's going all over the place. It's going all the good places that we need to maintain homeostasis. So in ABC, when we get to the circulation category, that's where we deal with bleeding control. Versus in March, we deal with bleeding control in two different places. March stands for massive hemorrhage versus we can deal with small bleeding, right? So there's 3 different types of bleeds you can have. You have from the 3 different places. We have capillaries, which are going to be very minor. Those are our scrapes that kids want little boo-boo Band-Aids on, which are a great thing to have, and we'll get to that soon. Band-Aids are a big one. But we also have, because of capillary bleeds, we also have veins and we have arteries. And we know that our arterial bleeds, right? That's the sexy stuff. That's the stuff we want to tourniquet. How do we identify that? How do we recognize that? Bright red blood, spurting, because it goes with the heartbeat, right? Because it's under pressure. Versus a vein, which is going to be deoxygenated blood. So it's going to be dark in color, and it's a steady flow. But both of those can be tourniqueted. I don't think tourniqueted is a word. You can apply a tourniquet to both of those types of bleeds. We'll say it that way. That sounds a little bit better, much more better. So you have to make that judgment call. Now, there's other ways to stop the bleed too, obviously. But don't be scared to apply a tourniquet. If it looks like it's heavy bleeding, go ahead and use that tourniquet. Now, we haven't seen, not something that everybody has seen is heavy bleeding that requires a tourniquet, which is a good thing. But there are ways to educate yourself. Online videos are a good source of doing so. And there's some cool little, things you can do at home to kind of simulate heavy bleeding by, food coloring in a certain amount of water and spilling that on the floor to kind of let you see what a, quote unquote pool of blood might look like, so you understand what heavy bleeding does look like. But again, don't be scared to apply a tourniquet. However, let's talk about some of the other ways of stopping the bleeding and tools you should have available. Gauze, your basic gauze, compressed gauze, rolled gauze. It's all going to depend how much room you have to fit that stuff in. And then you have all the gauze with the clotting agents that are built into it. They all have a time and a place, right? So your basic gauze, right? Let's just talk about gauze pads like 4x4s, 5x9s, etc. Those are going to be for more than what a Band-Aid would accomplish, but less than, something like a tourniquet or something like wound packing, etc. Right? So those pads are going to go on the surface area to cover up a wound, to stop the bleeding, etc. And that's going to be something you're going to use in conjunction with direct pressure, right? Placing that between your gloved fingers, hopefully, and gloves are important, and we'll talk about those in a few, and the injured site to apply direct pressure and stop the bleeding. For those of you who never have had to manage bleeding control, heavy bleeding control, understand that direct pressure is aggressive, it is strenuous, and it must be done for a long time. A lot of people, because we don't get those types of injuries, hold something for like 20, 30 seconds, and then you stop and you check to see if it's done, and it usually is because it's a little cut on your toe or whatever. That is not what direct pressure looks like on a serious bleed. It is several minutes of holding it there. Could be upwards of 10, depending. So what else do we have? We have some cool tools designed to do stuff like this. Israeli bandages. H&H makes that one with the hook, right? Those are going to be bandages that have kind of a gauze pad and some sort of elastic roller style designed into it to help you manage bleeding control with a dedicated tool to do so, right? So that's a cool idea. Good, handy tool to keep on you. Why do we keep roller gauze as well if we have something like that? Well, there's places that what we have to do they're called junctions, and what we'd have to do in those places are wound packing, right? Wound packing is a location, say like the pelvis, the armpit, places that we can't tourniquet, right? Because it won't work or it'll do more injury. and not work successfully. For example, the neck, right? We can't tourniquet the neck. We can't tourniquet the body, right? The general like trunk. So keep in mind those types of places you have to pack the wound, right? And the injury could be really deep inside of the person. You have to kind of go quote unquote fishing to find where that bleed is coming from and get down in there, start packing that wound. And you need a shit ton of gauze to really make sure that wound is packed thoroughly until it makes its way to the surface area where then you can wrap it up so that it holds its pressure there. So continuing on, what else is in circulation, right? That are things we should keep on us. Well, I mentioned before Band-Aids. Band-Aids is a really good idea because majority of the times when we're training, when we're out and about with the family, whether you have kids or adults, whatever it is, majority of the time we don't experience emergencies like these, right? What we do experience are kids falling on the ground, scraping themselves, adults getting paper cuts, cutting boxes open, whatever it is. Maybe even cooking in the house, right? You're cooking, you cut yourself, you have a nice sharp knife that you were excited that you just bought. Those are injuries that don't require massive hemorrhage tools, but they do require tools to stop bleeding and also make us feel more comfortable. Why do kids need Band-Aids for some of those little cuts, besides the part about keeping them clean and not getting infected, obviously, is it's also a comfort level. It's something that, when we see that cut and it's just a little bit of blood coming out, when we can just cover it up, we can continue on mentally too. So keeping those Band-Aids and those little things that we always forget about because it's not cool or sexy is a really important thing to have. And remember that we need stuff like that handy as well. So, continuing on. So we finished the ABCs there. Let's move over to March. So we just talked about M and C in that one kind of category. And the reason they say March like that is because going in the order of March is saying in the environment that you're specifically dealing with, being traumatic injuries, gunshots, stabbings, things that you'll see in a combative environment, what is most likely to kill the person first is that massive hemorrhage, which is why they're saying take care of the massive hemorrhage, move down the rest of the acronym, and go on. So, on that same note, if you choose to use ABC, that is fine, right? You just have to recognize what is the major injury that is likely to cause this person to become, no more, right? To become expired soonest. And sometimes our eyes play tricks on us, right? So understand what the priorities are, right? Because we might see some bleeding and we want to make sure we take care of that. And the person is suffering another injury, perhaps not breathing, which might be the priority in that situation, where if we don't correct that, it doesn't matter if we stop the bleeding, they are still no longer. So take a class, right? We teach these classes at Trinity. Take a class that's going to teach you order of operations, teach you how to understand what's going on in the human body. Continuing on, shock, dealing with shock. What are the rules to someone goes into shock, what to do? Keep them warm, keep them dry, right? So how do we keep someone warm? Blankets, right? Not something we can necessarily fit into an IFAC. Maybe those, sun reflective, those foil ones that you see people use in marathons and in survival, camping equipment, stuff like that. Those do a good job. But we can get bigger, maybe wool blankets, things like that, that we can keep in a vehicle, right? In case something like that happens. And people can go into shock. They don't have to be out in the cold to go into shock, right? Somebody loses a lot of blood in a car accident, they will go into shock. It can happen. So don't think, oh, why would I need a heavy blanket? It's the summertime. It's not what you feel. It's what the injured or ill person is feeling as they go through it. And understand there are many different ways to go into shock. And there's all different types of shock out there, right? So you have to be prepared to recognize what shock is and treat that, which is, again, keeping them warm, keeping them dry, right? So if somebody was in the winter and fell into the ocean, or not even the winter necessarily, but they were in the water for a long time, they can go into shock that way. So having a spare change of clothes handy is a good way to keep them dry, right? A towel, get those wet clothes off of them, put fresh clothes on them, cover them with a blanket, right? Provide oxygen if you have it handy. And then we're also going to lay them down on their backs with their feet elevated so that we can help the blood get back to the important organs that we need, right? They don't necessarily at that point in time need to be in the extremities where they'd rather be. We need them focusing on those organs that like to keep us alive, right? Those heart, lungs, brain, those kinds of things. So what other things, though, should we be keeping in our kits? Well, I have the list from the Red Cross here, and it's a really good reference point because it gives you a lot of things to think about that a lot of times we forget because it's not the cool, sexy stuff that we like to keep on, we see soldiers carrying, or we see cops carrying, or we see EMTs using on the street, or we want to buy a kit because we saw something cool happen, right? And I'm still talking basic level stuff. Afterwards, we can talk about advanced level stuff that you can keep on your kits that go back to the airway breathing circulation realm of things like needle decompression tools and crike kits and stuff like that. But that's really not what we're talking about. I want to keep it basic for the end user who can educate themselves with quality online resources and local classes that are accredited. But yeah, so let's look over this Red Cross list, right? About building your own first aid kit. So keeping a first aid kit in your home or your car, like we talked about. Carry one on your person. We talked about that. Okay, let's continue on. Really important. Yes, absolutely. Emergency contact list, right? That's probably a good idea to keep around. Now, thankfully, we all know 911, but is there also a local emergency medical service that might get to you faster? Maybe a volunteer ambulance service, if you live in a really rural county, might get there quicker than a 911 call will. I don't know. You know your area better than I do. If you're out in, a hick part of a rural town, it might be that case, right? So keep that in mind too. There might be other numbers to call. Doctor's numbers, right? If your child suffers, say your child suffers an asthma attack, maybe having a local number, your doctor's number, emergency number, he's going to help talk you through whatever is going on so you can help treat your child better than you previously could. What else? Going on that with the child, the asthma attack, let's talk about that a little bit. Specific medications for that individual, right? If you have allergies, there are certain things you should have in your house at all times. For example, things like Claritin and Zyrtec, which can be a daily medication that you can take to help manage your allergies, are a good idea. Benadryl is a good idea for those of you who, in general, whether you have allergies that you deal with regularly or you have once in a while, maybe you had something and for some reason you have an allergy, you got stung by a bee, you might have allergies, etc. Benadryl is a good idea. But if you have severe allergies, like I do, to certain things, in my case, shellfish, what you should do if you know you have that is get yourself prescribed an EpiPen. An EpiPen is extremely important because, plain and simple, if you have severe anaphylaxis, if you have severe allergies and you have a severe reaction where your throat closes up, you start to become light and dizzy, pass out, things that are dangerous, you are going to bottom out if you don't have that EpiPen handy. You need epinephrine in you, plain and simple. And all too often we saw in the EMS world, people were scared to use the EpiPen because it was a serious drug and trying to treat patients with Benadryl. It happens. Still does happen, right? An EpiPen is a life-saving tool. And if you don't have one and you need one, you need to get one prescribed to you. Try to get multiple prescribed so you can stash them in places. You can keep one in your car. You can keep one on your person, etc. It's a really important thing to have. If you live with someone who needs an EpiPen, or in general, learn how to use an EpiPen, right? Because when you find someone passed out and you see they have an EpiPen on them, there's a good chance they probably needed that EpiPen. I don't mean in their bed. I mean when you find them on the street or somewhere like that, at a restaurant, etc. It happened to me while patrolling on the road. We got flagged down by a vehicle. A guy came running to us saying his girlfriend in the car was having an anaphylactic reaction. She has an EpiPen. you know how that story goes. Why? Now, I didn't get to really have this full in-depth conversation with him, but I asked him, what are you doing? Why don't you use like, this is your girlfriend. You should have that conversation with her. Hey, in case you need this, how do I give you this EpiPen, right? So, get this training. Continuing on with medications. If you have asthma, have your inhaler, have albuterol handy, right? Get multiple prescriptions if you can. Keep them around. Keep in mind, guys, things expire. Make sure you stay up to date. Even lock expiration dates of your medications into your phone with like alarms that go off to say, hey, you need to get a new one, right? Because maybe the doctor's not on top of it and you have to be on top of managing your medications. It's all dependent. Any other specific medications for that individual? You have heart problems, blood pressure problems, whatever it is, have those medications handy. Okay? Now, not specifically prescribed medications that are handy to have, right? Anti-inflammatories, like non-steroidal anti-inflammatories. I'm talking ibuprofen, really good one to keep around. Headaches, general pain, you twisted something the wrong way. You're going to want to have those handy. Same thing when it comes to acetaminophen, right? Tylenol. Another thing that's good, fever reduction. These are good medications to have and keep handy. Aspirin's a really good one. Someone's experiencing chest pain. Is it possible they have a pre-existing heart condition? Even without having a pre-existing heart condition, are they having those telltale signs? Aspirin, specifically chewable baby aspirin, 81 milligrams, is a good thing to keep around, okay? Whether prescribed or not. So think about those general medications that you want to keep and handy, have on you, readily available. Those are going to be things that you would want. So I'm just going to read through this first aid kit for it's for a family of 4 is what they're talking about from the Red Cross website, and we'll see if we missed anything, what we'd want to add, etc. And there's already some stuff I'm saying that's a good idea. I'm not going to go through the numbers because the numbers are going to vary based on the size of your family or the size of people you want to build this first aid kit for, but this is going to be a good reference point of things to keep in there. So 5x9s we talked about. They'll be listed as ABD pads. They are not abdominal pads, but it's a good 5x9s are good ones. 4x4s are good ones. Adhesive bandages, right? Those boo-boo band-aids, good to have around. You can get the ones that are waterproof if you want to. You can get the ones that are more flexible so they don't come off as easy. You can get the ones with, Avengers and Hello Kitty and whatever else on there for your kids so they feel better when they see that little, figure on there. It makes them feel a little bit more comfortable. Adhesive cloth tape is really good for keeping those bandages stuck to what you want. They do a good job. Also, duct tape's really good, right? We know duct tape sticks to freaking everything. Gorilla tape does too. And it's hard to get off. That's going to help when it comes to dealing with chest seals and things like that. Oh, it's actually a good point. When we're in the respirations category or the breathing category, chest seals are a really important thing to keep around if someone's experiencing a pneumothorax, whether it be a tension pneumothorax. But really what you're going to need that's important when dealing with that is a open wound that you can properly seal off. Without that, they could be experiencing a pneumothorax internally, but if there's nothing there on the exposed on the basic level, you're not going to be able to really do much about that. So that's where needle decompression would come in handy. But again, we're not talking about what I would consider a more advanced skill for the general person, right? I'm not talking about the guys going overseas that are going through combat lifesaver and stuff like that. I'm talking about the layman walking around every day who has to deal with legal problems should they stab somebody in the chest with a really thick needle. Continuing on. Antibiotic ointments, yeah, it's a good idea to have around. Antiseptic wipes, like we said, aspirin ready, emergency blanket, a breathing barrier, right? So if you have to perform CPR on somebody, good idea to have a breathing barrier around. Now, I'm sure if it's a family member or a close friend, you would have no problem doing mouth-to-mouth should you need to. But if we can always take precautions and protect ourselves and the person we're treating, it's always a good idea. So some sort of breathing barrier is important to have handy. This is actually a good time to talk about gloves. Keep nitrile gloves handy in your first aid kits, right? It's going to protect you. It's going to protect the other individual that you're treating. And unlike latex, which is a rather stupid allergy to have, but people do have them, we don't want to be treating somebody for bleeding and we send them into anaphylaxis. So keep in mind, nitrile gloves, good to have. You can buy a box of them, and that will get you by just fine. Continuing on, cold compress, good idea, right? When we suffer certain types of injuries and we want to ice and elevate, those cold compresses are going to be able to be stored in your first aid kit for a very long time in numerous conditions, hot, cold, etc. And you can just, pop them and use them. Hydrocortisone ointments, sure. Roller gauze, we talked about. Roller bandage, we talked about. Sterile gauze pads, we talked about. Thermometer, very good idea. Somebody suffering a fever, somebody really cold, right? We talked about those cold injuries that people may go through. Good idea to have. Triangular bandages going to help with making slings, making swafts, stabilizing injuries in multiple different ways. We can get really creative with these things, and we can make splints, and we can do all types of things to make sure that these limbs, or injured sites, I should say, are immobilized. So really great. We can also use triangular bandages to make makeshift tourniquets, etc. There's a lot of uses for triangular bandages. It really, how creative can you get is the question. Tweezers are great for pulling out those splinters, but anything bigger than a splinter, we're going to leave in the person. Impaled objects, we definitely don't want to remove from people because there's a good chance it is holding a artery under pressure, and when we remove it, it's going to cause bleeding, and now we have a whole worse problem to deal with. So generally, if something that doesn't belong in a person is sticking into a person, leave it there. The only thing we're going to say remove is, like I said, those small splinters, the general ones that you get, right? If somebody gets a 2-foot long, 4-inch wide splinter, that is not something we are going to remove. We're going to let the professionals handle that. All we're going to do is stabilize it in place so it doesn't wiggle around and fall out or get knocked out, right? What else can we remove from people? We can remove stingers, right? Somebody gets a bee sting that is uncomfortable. You'll want to take that out of them. And you could do so by swiping a credit card towards it, right? Or some sort of card, some sort of that PVC type card, something rigid that we're going to use to push it out, because if we grab it with a tweezer, we might just end up squeezing the actual stinger, thus causing more pain to go into the person by means of whatever is in that stinger. The stingy stuff. First aid instructions could be really handy, right? God forbid something happens to you. If you have a little pamphlet in there that says this is how you treat this, that, and the other thing, and someone needs to use it on you, if they can do a quick read of what is going on and how to do it, that's a pretty good idea to have. So, tourniquets, really good tools to have. Obviously, we talked about that earlier with bleeding control. How many to have? That's as many as you think is necessary. Differences of opinions on how many you need of things. It depends also the environment you're talking about, where you work, what you do for a living, etc. But having those basic tools are going to help you and your family stay safe. I can tell you, I have an IFAK in my range bag. I have an IFAK on my person when I work every day. I have a vehicle first aid kit, which has more than just individual first aid stuff in there, because I may roll up on scenes where I want to be able to help other people, and it's happened before, right? Remember, you are statistically more likely to save someone with your knowledge and skills in medicine than you are your knowledge and skills in gunfighting. That is how statistics work. They give you facts, and that is it. I know it's not as cool as you would have hoped for, but that is the reality of it. And I promise you, it's a really great feeling when you save somebody's life. And a bunch of other people around are panicking because they're like, "What do I do? I don't know what to. I don't know what to do. There's a serious medical emergency going on." So, I think we pretty much covered everything for now. I will certainly be following up with more medical podcasts to come. I have a number of individuals I want to bring on the show whose backgrounds are combat medics, paramedics, flight medics, etc. All the different kinds of medics you'd want to hear from. We're going to bring them on the show, let them talk to you, and we'll get into the nitty-gritty about some more specific subjects, maybe related to gunshot wounds, maybe related to certain types of injuries that they have a vast knowledge on and can teach me something too. I'm always looking to learn. So, hope you enjoyed this episode of the Ricochet Report. Get some medical training. You can head over to trinitytrainingcomplex.com. We have first aid classes coming up for family first aid classes, which are going to be teaching moms and dads as well as the kids on first aid, right? It's really important to teach kids, because when you leave grandma to babysit your kids while you go on a hot date with your wife, of course, and God forbid grandma takes a slip down a flight of stairs and is unconscious, possibly suffering something horrendous, and your kids are there, knowing that they can confidently treat grandma and contact emergency services so that grandma can get treated, or whoever it is, that is going to give you peace of mind, knowing that your kids can possibly help you or a loved one, a friend, whatever it is, in their time of need. How can you help them in their time of need, etc., right? We need to get out of the mentality of, I'm useless, I'm just going to call 911 for everything I have, and we need to start trusting and believing in ourselves. That is the way to be successful in life, is knowing that we can handle whatever it takes. It's always okay to ask for help, but we are always there on scene first, because it's happening to us or happening next to us, and we are going to respond accordingly, and then have others, professionals, come and help us along the way. But we are there first. The sooner we can start treating something, the sooner we can help somebody. Same thing when it comes to guns. The sooner we can end that fight, the safer we are, right? So that is really important. So on that note, until next time, keep training and stay safe.
You're listening to the Ricochet Report.